We are back here on Girl Talk, and I'm really excited. I am in Beaufort at Beaufort Memorial, and we are here with Dr. Marlena Mattingly. Thank you very much for joining us.
Yes, thank you for having me.
You are an OBGYN, and we have had a lot of fun talking sort of before the segment started today. I'd love to know a little bit about your background.
So I grew up in Florida and Kentucky. Went to college at Belhaven, which was now Belhaven University in Jackson, Mississippi. And then University of Kentucky for medical school and Indiana University for residency in OBGYN.
How did you decide on the practice of OBGYN?
Actually, it was on the bottom of my list when I first started medical school. And then as I realized what I wanted out of a practice, I loved the combination of primary care and surgery and obstetrics, and being able to care for the whole woman throughout her life.
You know, it's interesting that you say that, because I think for me, I value another woman as my primary care doc, and from a gynecologic standpoint, it's the one consistent thing I've done throughout my lifespan. And I guess you develop a relationship. I mean, that's kind of the point.
Definitely. I enjoy being able to develop that relationship with my patients, even with my short time here in the past year, just being able to take care of a patient for her annual exam and then getting excited when she comes back with her pregnancy, and then being able to deliver her as well. So.
Well, I have to ask you, we were talking before, and I've got a daughter who is been married for 3 or 4 years and is thinking about starting a family. And of course, all she's talking about right now is Zika virus. I mean, it's everywhere you turn, it's ubiquitous. Talk to me a little bit about how you deal with some of these things that kind of occur in a timely fashion. What do we do? How do we, if she's thinking about getting pregnant, words of wisdom?
So with the Zika virus, of course, they haven't actually found haven't had any cases from mosquitoes here in the U.S. Most of the cases have been travel associated. But we've been advising our patients to avoid traveling to those countries that have the Zika virus. For sure. I've actually had some patients cancel some vacations, unfortunately, in order to avoid those countries if they're planning on becoming pregnant or if they are already pregnant. And then precautions you can take living here in the low country, for sure.
Mosquito mecca.
Yes. Trying to wear more long sleeve shirts and long pants if you're going to be outside, especially in the marsh area or other areas where there might be a lot of mosquitoes. Using DEET containing mosquito repellent that's safe for pregnant and lactating women as well, to try to help prevent mosquito bites.
Okay. Is it something that you are concerned about? And if you have these newly pregnant young women, are you advising them? And is it something to pay attention to?
It definitely is. I think a lot of our newly pregnant patients, when they go through their initial nursing visit and then their initial OB visit, we're either talk to them about it or they're going to bring it up if they're thinking about traveling to those places, for sure. I know I've had several women ask me about vacations or just vacations here, going to the beach, what they should be concerned about and precautions they should take.
If someone is pregnant, then do you monitor them for that? Or, I mean, when they come in for their monthly checkups, are you like, do you have any mosquito bites? Or, how do you know? I mean, are there screening techniques?
Not necessarily. The main screening is just asking about their history.
Okay.
At least at this point, since we haven't actually had any mosquito-borne cases here in the United States. If we know someone that has been exposed, possibly exposed to the Zika virus, been around someone who was recently diagnosed, then those are the types of patients that will report for testing. We'll do more frequent ultrasound monitoring, looking for findings like microcephaly that is associated with the Zika virus.
When someone is pregnant now, because when I was, back in the good old days, it was you were 3 months pregnant before you even recognized that you were pregnant half the time. What is the protocol now? How often do patients come in? When do they start their first visits? What does that look like? Yeah, so for patients who find out pretty early nowadays that they're pregnant, usually they'll come in and have their initial OB nursing visit around 6 to 8 weeks and get their confirmation ultrasound to confirm exactly how far along they are, what their due date is, and then they'll see a provider within the next couple weeks, around 8 to 10 weeks for their initial doctor or provider visit.
And then for that first and second trimester, it's every month.
Okay.
Third trimester, 28 weeks, it's every 2 weeks. And then the last 4 weeks of pregnancy, it's every week, so we can monitor the patients more closely.
Talk to me about, I'm kind of all over the board, but I think your practice is very broad spectrum. So I want to make sure that we at least touch on different things and get you back another time so we can talk more specifics. So we talked about people who are of childbirthing age, if you will. If you are, at what age do you like to see a woman come in for their first visit?
For just their annual
Yeah, just an annual checkup. And I think the reason I ask you is I work with a lot of adolescents. And the girls that are probably 15 through 22. And it's been fascinating for me how few of them have had an appointment with a gynecologist, an OBGYN, where I think it would be very helpful from an information and education point of view. Can you share with me a little bit about your point of view on that, or the recommendations?
It depends on what you're looking for out of the visit. For pap smear screening, which is cervical cancer screening, that starts at age 21. So those patients, or those girls, are once they turn age 21, then that's when they get their official annual exam with their pelvic exam and everything as well. But definitely I encourage patients to be seen sooner, especially if they're thinking about becoming sexually active. So we can talk about STD screening and prevention. And contraception as well.
It's really interesting to me. You're wonderful. I think you're very user-friendly, which is really important. Well, I think to anyone, whether they're 62 or 16, I think it's really important to come in and see the doctor. And I'm really excited that you joined us today. She's pretty cool, you guys. We want to thank you all for joining us here on Girl Talk. Have a wonderful week. Bye-bye. Beaufort Memorial Obstetrics and Gynecology Specialists see patients in 3 locations: Bluffton, Beaufort, and Port Royal. To make an appointment with Dr. Marlena Mattingly or any of the OBGYN providers, call 843-522-7820. For more information, visit BeaufortMemorial.org.